Well, it's time now for our Sunday specials. The abuse of drugs and other substances along with related crimes has significantly contributed to the growing number of young Nigerians behind the bars in recent years. Well, this report dives into the connection between socio-democratic factors and substance abuse, focusing on users with mental health challenges in Benue State. Mayawa Okwato reports.
When you take them too much, they make you tipsy, and they make you unable to do what you want to do. So I think the thing should be on a low, it should be reduced.
When they take it, their behavior change. We should understand that if you are to even do anything, do it moderate. I don't even allow friends who do such closer to me so that I will not be addicted to such.
We are tackling a topic that's affecting families, communities, and individuals across the country: drug abuse. In this report, we'll be exploring the devastating consequences of addiction, speaking with experts and individuals struggling with substance abuse, and also we'll examine the efforts being made to combat the growing epidemic. According to a report by the United Nations Office on Drugs and Crime, 14% of the Nigerian population aged between 15 and 64 abuse drugs. That's more than double the global average of 5.5%. That means roughly 1 in 7 adults is involved in substance abuse. Experts say this alarming trend is not only damaging lives but also worsening the country's mental health crisis. Many cases of mental illness today are linked to substance abuse. A visit to the Federal Medical Center in Makinde reveals the rising number of mental health patients, many admitted due to complications from long-term cannabis use.
More patients with cannabis use disorder, marijuana use. Maybe because this plant is grown all around us, maybe it's easier to cultivate and process for use. That's the only reason I can give for why we have more patients with cannabis use disorder. And research has shown that you use cannabis for a long time, high doses, is associated with psychosis. It's an area that's been well researched. So we see them coming with psychotic disorders in their hand, young persons, all over the place. They claim they want to do music, they want to do fashion, they want to have inspiration, and from the use of these substances, they have a mental breakdown. Sometimes they're on the streets, sometimes they're in prayer houses, sometimes they land the psychiatric clinic. They're all over the place. I can tell you very confidently, cannabis use is a big problem in our society.
Once a drug dealer and addict, Raymond Agibi is now a counselor committed to helping others walk the road to recovery.
I started using cannabis sativa at the age of 11. I was in Form 3 then, which is JS3 now. And prior before that time, 2-3 years before then, my father was an alcoholic. So as the firstborn of the family, I'm always closer to him, and that was how that started too. I went to the famous bar beach. One evening I discovered that people come there to relax, people smoke, all these things. I was just watching. Then when it was dark, a white man came there with his wife and was asking me how he can get a wrap of the cannabis. So I promised getting him one, which I went that night, I got it. Then cannabis, a wrap was sold for 15 naira or so. But this man gave me 200 naira. Immediately, what came to my mind was, that means I can be making money from this thing. And that was how I became a dealer. At a seminar, I went to share experience. The convener of that seminar after that called me that, what am I really doing? I said, no, nothing for now. That this thing I've just said, do I know I can make a career out of it? I said, okay. But how do I go about it? I'm not a graduate. He said, you don't need to be a graduate. That I will talk to you. So after some weeks, he called me that there is a training that will be going on somewhere about drug addiction management. He wanted me to attend that training. So that was how I paid and attended the training for about 4 weeks or so. Certificate awarded. And the next step, make you have a license for counseling too. So later I still went through that with an NGO that is a facilitator to UNODC, that is United Nations Office on Drugs and Crime. So after that, I started working.
I started using drugs when I was in class 6, like Canadian Lao. So then I was like, everywhere is good like that. So it reached the stage that after secondary school, like I met a guy. So when I met the guy introduced me to ice. Yeah, it's like if I take it, I will feel okay and everything. So I was consuming an ice and over. So I was like losing my weight, everything. My mom called me on a very fateful day and said that she don't like the way I'm looking, that I'm looking down. She will take me to rehab. Now I can do without drug, like I'm good. But then I was thinking that, yeah, if I don't do drugs, like I won't do many things because it motivates me and many more.
Yeah, I started doing drugs a long time ago when I started missing my dad. Yeah, I lost my dad like 25 years ago, a couple of years ago. So when I started having some empty spaces in my heart, when some friends introduced me to it, I was a drug dealer. I used to do drugs, sell drugs for survival. But now, I thank God so much that being here has taught me how to live without drugs, and I love it this way.
I started taking drugs in last 2 December. It was argument that made me test the drug. So one of my friends, they were taking drugs inside the house. So I was one advising them that they should stop. They say if I test it, I can never leave it. I doubted and tested. As I tested it, it was so sweet. So I went to buy another one that night. So I started this 1 year and 7 months. But as I came here, you can see my body. Before I was very slim.
Combating the epidemic, the National Drug Law Enforcement Agency says it's stepping up its efforts to reduce trafficking and access to illicit substances.
The most vulnerable target audience are the youths, because the drug use survey carried out by UNODC in 2018 has it that about 14.3 million Nigerians are using drugs. That is a ratio of 1 in 7. If you take 7 Nigerians, 1 out of the 7 will be a drug user. And then most worrisome that women and children are also getting indulged. So the drug abuse problem is a problem that we have to tackle holistically and collectively as a society.
In local communities, traditional institutions are getting involved in providing solutions.
Coming to India him, we call Igbo. India him. They can smoke, take from public road and be smoking. I don't know how it comes about. We get government, we're supposed to stop that nonsense. But we can't stop because we don't get power to fight them. To fight them. When you call them to come to your house, to your parish, they will tell you, say, please, chief, they give you chief, not be me. They give you chief, not be me. So you fear. If you keep on talking, they will say, today you are not going to see the sun again. That's why some of our people, we fear. We fear. We get to only one life. We get to only one life. we don't get two. Then what we can do, we will go and report to the government that let them just come and help us. We make council every Wednesday, we make council in our area. We call aiders to join us so that we can easily finish one and for all. But no way. When they come, they begin, when they started going, they say, you dare to the chief meeting where he called. You dare to the chief meeting where you call. Please be aware of yourself. So what do you do?
As the fight against substance abuse continues, what's clear is this is a national emergency, one that requires medical support, legal enforcement, and community involvement. If you or someone you know is struggling with addiction, help is available. Reach out to your local health department, religious organization, or a certified rehabilitation center. Mayowa Okwato, TVC News, Makode.
Well, our correspondent Mayowa Okwato joins me now to share his perspective on what he uncovered in this report. Mayowa, I can see that you spoke with a few respondents, those who were rehabilitated from the drug abuse, the substance. Give us firsthand of how they felt and how they're able to reintegrate themselves back in the society. What are your findings so far? Abuse in Plateau. Well, let's quickly move on to our next story. As soon as we're able to get him, we'll have the discussion. But in January this year, TVC News brought to you the report of Kano's historic Kofar Dye Pit, which has been seeing a decline in activities. And after that report, the Kano state government has announced plans to revitalize the site and create export opportunities for its products. And TVC News senior reporter Ibrahim Isa has details.
We recently visited the Kofar Dye Pit to meet with the artisans who are struggling to keep this centuries-old tradition alive. The dye pits, which have existed for over 500 years and are gradually becoming extinct, with only 20 out of the 144 pits still functional. The aged artisans blame the lack of support from local, state and national governments, urging authorities to help revive the ancient dye pit and promote its products in international markets.
Veteran local dyes here express concern about lack of export opportunities. They call on the government to weigh in and provide solution to the problem.
Now the government has responded. The Commissioner for Commerce, Shehu Sagagi, in an exclusive interview with TVC News, described the Kofar Dye Pit as a vital cultural and economic asset. He revealed that the government has laid out plans to renovate the site and connect the artisans to broader business opportunities.
We are very much aware of this problem, and we are going to help them to do it. And what we will do maybe is to collaborate with the Chinese people to come and join hands with them, form a partnership so that they help these people to improve their standard, they improve the quality, that it will be of exportable quality, because that business is as old as Kano, is older than Kano. So traditionally, we will not allow that to die, and we will help them. And I'm the chairman of the Kano State Empowerment Committee that was established by His Excellency. I'm going to discuss with the ESCO and find out ways that we can assist them so that they operate profitably.
The Kofar Dye Pit operates under the Kano State Tourism Board. The board's managing director, Tukur Sadagi, reaffirmed the government commitment to transforming the dye pit into a major tourist attraction and business hub.
I want to tell you and assure you that the present government is all out to develop our culture and traditions. In line of that, we have plans to renovate the Kofar Dye Pit, Zagi Dye Pit, and Kofar Tannery. On assumption of duty, in August 2023, I submitted a request to His Excellency for the renovation of these 3 sites. I made the request considering the importance of these sites.
As part of the initiative, the government also plans to organize training programs for young people to learn this age-old craft, ensuring its sustainability for future generations.
We are trying to see how we can cooperate with some institutions, international and local institutions, to see how we can further develop the area and take the youth and probably come up with a policy. Maybe some of the items that are being used in government offices or as uniform and things like that, maybe government will use those particular produced items so that there will be continuous production and people will be gainfully employed.
While the government plans have sparked optimism, the timeline for the complete revitalization of this historic site remains to be seen. Ibrahim Isa, TVC News, Kano.
And that's it on TVC News at this hour. For more updates on the stories we are monitoring, you can check us on our website, tvcnews.tv. You can also follow us on all our social media handles, Facebook, Instagram, and on X at TVC News NG. On YouTube, we're live at TVC News Nigeria. Many thanks for watching. On behalf of the team, I'm Esther Mokwariola. Bye for now.